my name is Pete Gordon. I'm Head of Emergency Care Improvement with ECIST, the Emergency Care Improvement Support Team, and welcome to our latest ECIST Bitesize Podcast. So today I'm joined by my colleague, Chris Green. Do you want to introduce yourself, Chris?
Hi everyone, hi Pete. My name's Chris Green. I am the Head of Informatics for the Emergency Care Improvement Support Team.
Brilliant, thanks for joining us, Chris. So for this podcast, you're going to talk us through the bed modelling tool that you've developed and you've used to support multiple organisations. Could you give us a bit of background about the tool?
Yeah, of course, no problem. So it's had various different iterations, the bed model, but I think the first way in which I created it was when I worked at an acute provider, which I worked at for about 8 to 9 years. And it was just during the annual business round, to be fair, that every trust in the country has to go through in various different guises, and we were just looking at activity to kind of say, how's it going to be costed, etc. But there was nowhere that we actually looked at capacity in terms of beds. So we did capacity for outpatients, etc, but not really for beds. And we just started to kind of bat it around in one of our general monthly business meetings between me and the clinical leads for the division and the clinical service managers. And so we just kind of wanted to think, well, could it be done? And so we just went on typing in NHS bed modelling, and I came across some work by somebody called Professor Kate Sylvester, that many people will be aware of. And her work was absolutely fascinating, and she'd been doing this work for a period of time, and so I just piggybacked off the work that she did, which was looking at two very simple variables and extrapolating that theory to kind of whatever degree you want. It was something that we put together quite quickly just to kind of get a proof of concept. Does it work? Does it do what we need to do? And then before long, we kind of turned it into a bit more of a professional looking model and started to use it in anger.
Brilliant. Okay. Next question. What are the top sort of 3 things that the bed model can help people to do?
Yeah, absolutely. So the bed model was designed to use historical data to forecast for the next 18 months. So I think what I would kind of stress, operational bed model, this is a strategic bed model. An operational bed model will be much more how many beds do we need tomorrow and the next day and the next day and the next day. This does not do that. This has a look at how many beds do I need per month. So how many beds will I need for the whole of July, August, September? And what it's really designed to do is it was really kind of designed to particularly look at the winter period as historically been written about, the need for beds post-Christmas going through the winter period into March and April has historically been very high, and to be able to plan how many beds you're going to need is phenomenally helpful. And so what it does is it uses historical data on terms of the amount of patients you see and the amount of time those patients spend with you to forecast going forward. It uses a relatively simplistic algorithm for prediction. It's not particularly sophisticated, but when we've been around to organisations, they understand it, and more importantly, it is as accurate as they need it to be. Could it be more accurate? Yes, it could be, but we're definitely down the mantra of roughly right is better than precisely wrong. And I always do that when we do predictive work. If you predict something to a specific number, people will hold you to a specific number. And so actually working with organisations to kind of say, well, actually, if you want to hit X bed occupancy, you will need this many number of beds. That's exactly what the bed model does. But then that was kind of the first iteration, which just said, this is how many patients you have, this is how long the patients spend with you, this is how many beds you need. The new bed model goes into much more levels of granularity. So now you can have a look at, if you were the divisional director for medicine, you could just have a look at medicine. If you then wanted to pass it on to your service manager, so they could have a look at cardiology or gastroenterology or neurology, etc., you could go down to that level. And then even now, I've now moved the model forward so that it can have a look at every type of patient, or it can also split between elective and non-elective. And that's going to be particularly important in terms of elective recovery since the COVID pandemic began around 18 months ago. But what it can also do is also have a look at scenarios. So you could also say, well, using historical data, your level of non-elective medical demand is going up by 3%. But what if you actually, because of something that's happening with commissioners or something that's happening in your local area, you expect it to go up by 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, 5%, automatically going forward for not only the amount of patients, the length of stay, but also the beds required. The first iteration kind of went down the route of only doing one scenario selection at a time, but now you can make as many scenario selections as you want. So if you wanted to have a look at the different levels of specialty, increases in elective work, you can put down the amount of length of stay, decrease that's going to happen with the amount of work you're working with social and community care providers, you can put that in. And it will build up a kind of an accumulative effect on the forecast, and it will make that adjustment to patients, length of stay, and the beds required, so that you can look at the mitigating factors for any surplus or gaps that you might have.
Thanks, Chris. And so this podcast has been recorded at the end of June, but we know winter is coming. So what would your top tips in terms of the use of people, advising them to use your bed modelling tool to help with the inevitable pressures that winter brings?
Yeah, so my top tip is know your data. Okay, and I use that term loosely because some people call it data, some people call it information. Okay, but if you're just looking at the crude number, that is a piece of data. Okay, it's then we're moving on to information. But know your data, so that if you are using this model, know that if your analyst says to you, last month we saw 1,800 patients through the front door, you would know that that's true. Okay, and there are some ways in which that might change, because you might want to have a look at an episode level rather than a spell level, but knowing your data is really, really important. But then also understanding the interdependencies within each individual organisation, and certainly something that we're picking up with at the moment is around system dynamics. So understanding the different parts within the system is vitally important to work out the impact that doing one thing over here. So for example, if we're going to make a reduction in long length of stay patients, okay, well, what is that in terms of a reduction in our overall length of stay, so that we can change that to our long length, our overall bed numbers. And the third one, and this probably seems like a really simple solution, but it's actually to know your bed numbers as well. When I worked in an organisation, and the organisations that we currently work with, and we go around to places to say that, how many beds do you have? And the amount of head scratching that we see is phenomenal. You would think that beds are pretty big, and they don't necessarily move, they're pretty fixed, and they're not hiding anywhere. So actually understanding and knowing your bed base is crucially important to understanding what has happened in the past to work out what potentially might happen in the future.
Yeah, brilliant. Thanks, Chris. And last question. So I think we know people are interested in your bed model. Where can they access it?
Yeah, there's two main places where they can access the model, either on the NHS ECIST Futures website, which I believe the link will appear. Also, I'm happy to be emailed. My email address is chrisgreen@nhs.net. More than happy for anybody to get in contact via either of those two media, and I'll be more than happy to help support them through the process.
Brilliant. As ever, Chris, it's always a pleasure to speak to you. Thank you very much for your time.
No problem, Pete. Take care.